I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this special video edition on patient responsibility. So this comes up a lot with patients, and I see it all the time, and I want you to picture, for example, you've been given a gift certificate to go to do some skydiving, and it's great. You think, wow, what a great gift, and you've got all these rights that the people will train you and they'll take you up in a plane and they'll show you what to do. They're your rights. You're going to be safe. But you're also responsible for yourself, that you will listen, that you will learn, that you will do what your instructor says and not do anything else, and make sure that you understand before you commit everyone else on the plane to what could be a major problem. So they're your responsibilities. You wouldn't go up to the top of a building and expect to jump off and that gravity would come and grab you up and land you safely to the ground. No one would do that. When we're dealing with the world of physics, we lose, and it's really a harsh reality, but it's no different with biology, and that's the subject of this talk. In most modern countries, you have rights when it comes to your medical care. So those rights mean to good care, to proper care, appropriate care at the right time by the right people who are qualified in the right place. They're your rights. You've got a right to privacy. They're your patient rights. But your rights are only one side of the story. With rights come responsibility, and you've got to exercise those responsibilities responsibly, because without responsibility, your rights are meaningless. So what do I mean by that? If you decide you want to go ahead with surgery, please speak to your surgeon. Find out what's involved. Find out everything you need to know to fit in with your lifestyle, for your condition, for what's needed. Listen to what's being told. Follow the instructions. Quite often patients will say, oh, I forgot, don't remember. I've had a patient this week who said that what I'd written in my notes was completely opposite to what I'd written, but it wasn't. You've got to follow your instructions. They're there for a reason. They're not there for fun. We don't make this a joke to make you follow instructions for no reason. They have an outcome. They're there to help you. So listen to them, follow them. Take your treatments, and please attend your appointments. Don't ring up and go, oh, I forgot, I'm too busy for my follow-up check. They're there for a reason. Wound healing takes time. Doesn't matter whether it's neurosurgery, orthopedic surgery, facial surgery, whatever. Wound healing takes time. So that is your responsibility. But responsibilities go further. When you have surgery, if you choose to have surgery, and you are not in good health, you are going to compromise your outcome or delay your outcome. So part of your responsibility is to maximize your health. That's not difficult to do. A lot of patients choose not to. They think they can have a surgery, defer to surgery, give me a surgery, give me a pill syndrome, and everything will be fixed. I understand why people think that. The medical profession tells you they've got a pill for everything, but we don't. You've got to get yourself in good health. That means a good diet, manage your weight. If you're diabetic, do everything you can to get it under control. Lose weight before surgery. I find with wound healing, vitamin pills help. Vitamin B, C and D are really important. Most of us are deficient in vitamin D. But a good diet is essential, and get yourself as physically fit as you can. Mobilize and manage your mind. A positive mindset helps. All this helps. So why discuss all of this? Because a lot of patients, I have noticed over the last decade, resort to abrogating their responsibility entirely. It's all the doctor's fault. Well, it isn't. You've got a role in this to play, and your role, the better you play it, the better the surgical outcomes. It's a simple observation. I see it all the time. The ones that have the most problems are the ones that contribute least to their outcome. So your responsibility to your care really does rest in you, and that's great because it means something you can control. You're not dependent on anyone else, but you need to do it. Unfortunately, we see a lot of people who don't do it resorting to an infantile tantrum-like state, where they blame everyone in an attention-seeking tantrum, go onto Google, write negative reviews about everyone and everything involved, and expecting that's going to make things better. It doesn't. So be an adult, do what you need to do, find out what you need to know, and get on with it. Your health will thank you, your post-op recovery will thank you, you will thank yourself, and your surgeon will thank you, and you'll be better for it. I hope this is of help. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.